So essentially 1 year of being done with training and being out in practice. Well, here's how it went. What's up, guys? Welcome back to the channel. My name is Dr. Antonio Webb. I'm an orthopedic spine surgeon here in San Antonio, Texas. Wow, it's crazy. It's been a year that I have been done with my training and have been out in practice. And it's been a while since I've uploaded a video for you guys. I've been extremely busy with a lot of different things, with life, with work, with traveling, as much as I can during the pandemic, and just haven't gotten around to put out much content. And over the next few months, hopefully that will change. I'll show you guys what is it like to be a surgeon, be on call, private practice, all of those things. But it's crazy that a year has flown by. It seemed like just yesterday that I was finishing training, really excited about graduating fellowship, going out in practice, and then a year goes by. Well, this has been a really challenging year, to say the least. Not only just being in the middle of a pandemic, but also trying to build a practice is difficult. It's challenging. It takes 3 to 5 years to build a practice, a mature practice, and when you're coming out of training, you have this mentality, this Superman mentality, like, hey, I'm gonna fix everyone. I have the skill set. I have all this knowledge. I have all these years in training, and I'm gonna go out and save the world. Well, that's not how it works. It's not really realistic. What I've learned over the last year is that you can't really help everyone. Even though you want to, there's been lots of patients over this past year that come in to see me as a spine surgeon when everyone else turns them down maybe, or no one else takes their insurance, and they see me as a patient, and it's frustrating, to say the least, when you really want to help these patients, but you just simply can't. And as a surgeon, we love to operate. I love to cut. I love to be in the operating room, but there's certain patients that surgery may not be their best option. And there's other things that may be able to help them outside of surgery. So that's one of the biggest things that I've taken away this year, is that you just really can't help everyone, even though you aim to do that. And that's why you go to school to do all this training, do all this studying, and you want to help everyone that you can, but it's impossible. It's very frustrating also. Secondly, what I've taken away from this year is that you are responsible for everything that you do, all your actions, whether that's signing patients up for surgery and you forget to send that patient to cardiology to get a clearance because you forgot, or you maybe overlooked that patient was on Plavix for coronary artery disease. They had a myocardial infarction like 10 years ago, and life gets busy, things get really hectic, and you have all these patients that you're trying to manage, and that may slip through the cracks. As a resident in training, you have multiple people kind of looking at over various things, especially on the trauma service where things can get very busy. But in practice, it's me and I have a medical assistant. So everything falls on me. If something from a scheduling standpoint, or if a patient has some sort of complication, that falls on me. Unlike when you're in training, that goes to your staff, and to maybe the chief resident, your intern. So that's another thing that I've really taken away from this year, is that you're responsible for everything. They're gonna call you 2 o'clock in the morning if your patient has a problem. It's not like, oh, call the staff or call the other resident on call. That's you. Another thing is that it takes time to build a practice. As I mentioned, it takes 3 to 5 years to build a fully functional practice. I started off having a handful of patients in my clinic to kind of, over the past year, having anywhere between 20 to 30 patients in office and clinic that I'm seeing, which is pretty amazing for a first year surgeon right out of practice, that you have referring doctors that send you patients, and your clinics get busier over time. And very frustrating, to say the least. It's quite honestly been depressing, because you are going from a really busy part of your life, being in training, chief resident, fourth year resident, going into fellowship, where it's busy, very busy, to going out in practice, and you're just sitting around like, hey, where are these patients? Where are these surgeries? You have to do all those marketing things to get out and get your name out there. So patience is a virtue. That's what that's this old saying, and you really have to just be patient, keep going, being nice, being available, being accessible, and that's how you build your practice. But this year, it's been a very challenging year in terms of that responsibility, that transition from being a trainee to you being the person that's responsible. But it's also been very rewarding, just helping patients. And I've had patients cry in my office, like, Dr. Webb, you really changed my life. I was in so much pain, or this was really bothering me. You took me to surgery, and I can't thank you enough. And they want to give you a hug and give you gifts. So it is rewarding in that fact, but it also is it's been a challenge. But I've enjoyed this past year. I've grown not only as a person, as a doctor, as a surgeon. My surgical skill set has definitely developed over the past year, and that's why they call it practice. Each year should get better. Each day should get better. You learn and try to improve each day. But hopefully I could bring more content over the next couple weeks, 2 months for you guys. I know I've been absent, been extremely busy. Burnout, also the last thing, burnout is it's real, but it's also important. We should talk about this more. I've experienced that, to kind of be very apparent and transparent, over the last few months. At one point, I took 3 weeks of call. I was on call for 3 weeks straight, just trauma call, and really got burnt out doing that. So you have to make sure that you pace yourself, have an outlet to medicine, have someone to talk about your feelings and things that you're going through. Medicine is challenging, it's hard, but it's very rewarding also. So this is Dr. Webb. Year 1 is down. It feels really good, and looking forward to seeing what the next number of years holds for me. This is Dr. Webb. See you guys next time.